Now let's describe the surface anatomy landmarks. And we're going to start by describing this one in the square. Gluteus maximus, well, nothing else to say, are your butt cheeks. Uh, the bulk of your buttocks is made or consists of your gluteus maximus. The natal cleft is this vertical line or groove separating both your right and left uh, butt cheeks. The gluteal fold is this groove, like marking the boundary between the gluteal region and the posterior aspect of the uh, femoral region. Then the ischial tuberosity. If you're standing like this guy, you won't be able to feel it because gluteus maximus is covering the ischium and the ischial tuberosity, which is, well, actually at this level. Let me grab yellow so you can see where is the location. It's like at this level, the ischial tuberosity. But when you see it, the gluteus maximus uh, moves up, contracts and moves up, and the ischial tuberosity is subcutaneous, is right under the skin. So to palpate that structure that you will, when you are examining a patient with any, lesion about on the hamstrings, you want to touch the point of origin, right? And to do that, you just ask the patient to uh, flex the thigh, and then you will be exposing, or to sit, and then you will be exposing the um, ischial tuberosity. The greater trochanter of the femur is felt, is not seen, but is felt around this area, okay? But anterior to that area. You're gonna place your hands at the level of the hip, and then you can feel that uh, uh, bump in there. Move your hips, especially abduction. Abduct your hip, and you will feel it moving. Okay. Usually there is a hollow located posterior to the greater trochanter, and just we say it's like a depression. Oh, sorry. The due to it's just considered a safe area. Uh, Injections in grown-ups, in adults, are given in the, it's called the ventral gluteal site on the gluteus medius. Of course, not in the gluteus maximus, because we don't want to take the risk of damaging the sciatic nerve. That sometimes this is the typical location, but it can be superior in some individuals, and you might damage it. So, preferred point to administer an injection on the grown-ups is in the ventral and gluteal side. On babies, remember that we said on kids is on the vastus lateralis. Now, what can we see in here? Let me grab my pen. And we will see the, well, not see, but touch the medial and lateral condyles of the femur. Just is in the anterior aspect of your thigh. So right in here, you can press and feel it, feel the medial condyles moving, and in the medial or anterior to that medial, and in the medial side, your patella. Hamstrings. I'm not gonna show you my hamstrings, but it looks something like that. I wish. So the hamstrings, you can see right in here, that's the biceps femoris on the lateral side. In the medial side, what can you see? You can see this one, and you can barely see this one. So semimembranosus and semitendinosus. And see that they draw like a fossa, see a depression behind your knee. How do you call the space behind the knee? Popliteal. So they mark the boundaries of the popliteal fossa. Okay, which consists of, in the superior and lateral aspect of this fossa, consists of the biceps femoris. The medial and superior aspect of this fossa consists of semimembranosus and tendinosus and semimembranosus, and the inferior and lateral aspects of this fossa, we haven't described these muscles yet, but just so you know, they consist of the gastrocnemius. Gastrocnemius have this lateral and medial head, okay? And then you have these popliteal fossa. The importance of this is that when you place your fingers in there, you can palpate, look at that, this artery. How are you going to call an artery passing through the popliteal fossa? The popliteal artery. Okay, look guys, it's putting everything together. Do you remember we described last class the adductor hiatus formed by the insertion on the femur of the adductor magnus? Okay, so the femoral artery is located on the anterior aspect of the thigh, and then it crosses through the adductor hiatus and is located now in the posterior aspect of the knee, in the popliteal area, and is called the popliteal artery. But it's the same artery, the femoral and the popliteal, just different locations. In here we can see another another almost perfect, right? Another example of the popliteal fossa. Here you have it as a surface anatomy landmark. This is the tendon of the biceps femoris. Here you can see vastus lateralis. You can see the tendons here of the semimembranosus and semitendinosus. These are the gastrocnemius that we will describe next class. You can see in here, again, the fossa, okay, but now the anatomical landmarks. This is the biceps femoris inserting on the head of the fibula. This is the semitendinosus, the semimembranosus, and both gastrocnemius. And you can see the blood vessels, the popliteal artery, vein, and nerve passing through that fossa. Then we have, this is a lateral view. Let's see what we can identify in here. Well, oh, it has numbers. Number one, well, this is a fascia, don't worry. In here, we can see this is tensor fasciae latae, which means that this is your iliotibial tract. All of this, okay? See the insertion in here. Amazing, right? Of the iliotibial tract. Look at this guy. Look at, it looks like my gluteus maximus. This is the gluteus maximus right here, okay? In here we can see, well, this is cool because you can see this is the head of the fibula. This, can you see it? That's the tendon of the biceps femoris. And you can see all of this is the long head of the biceps femoris all the way to here. And this is the short head of biceps femoris. Okay, so this is the long head of biceps femoris. And this is the short head of biceps femoris, okay? And then you can see both attaching the tendon into the head of the fibula. Let me go back so you can see the structures without all my scrabbles, okay? So the tendon, long head, short head of biceps femoris, iliotibial tract, gluteus maximus. This is just your vastus lateralis. This is the insertion of the iliotibial tract. Look at the patellar ligament, okay? And this is the head of the fibula. This is gastrocnemius. That's it. See you next class to describe now the muscles of the leg and the surface anatomy landmarks of the leg. See you guys. Take care.